So as facial plastic surgeons, we can do a lot of things to manipulate the position of the eyebrows. Sometimes we can do those things with Botox, sometimes we can do them with surgery. So let's break down how those work. Botox is an injection that will stop the muscles from contracting. Some muscles around the eye will pull the eyebrows down. This muscle around the eye is called the orbicularis oculi muscle, and it's a purse string round muscle. On the outer quadrant of it, the outer half here, this muscle is always pulling the brow down. So when we do Botox to this part of the muscle here, it relaxes this muscle and allows the brow to elevate. Obviously, your great injector will know how much is appropriate to elevate to not give you a Spock eye and how to take in other factors as well. Then we also have the corrugator muscles here. These muscles also pull the eyebrows, the inner part of the eyebrows, down. That's why when you get Botox injected to it, it's stopping the downward pull and allows the eyebrows to lift up. Up here is something called the frontalis muscle. And this is the only muscle that works by lifting the brows up. When it contracts, it lifts up. But every time we lift up our eyebrows, we get these deep creases. So you can imagine when you treat the only muscle that's actively pulling the eyebrows up with Botox and stop it, you have a greater risk of dropping the eyebrows down. So that's why some people will say they have heaviness afterwards. That's why it's so important to go to an injector who knows the proper way to evaluate the frontalis muscle and all the other factors to do the injection the proper way. So between neuromodulation with Botox that can manipulate the brow and this forehead wrinkles, as well as brow lifts, we can do things in combination to really get a natural look that looks bright and happy.